Welcome to the Deep Dive. We sort through all the noise to bring you, well, the clearest insights. And today we're really plunging into something that hits close to home for so many cat owners. Feline hyperthyroidism. If you've got an older cat, maybe you've heard about this, or perhaps you're even noticing little changes in your own friend and wondering what's up. Our goal today, it's simple. Give you the key information, the essential stuff so you feel informed and ready to support your cat's health. We've looked at a whole stack of sources, vet insights, research papers, even a really touching story about one cat's journey, all boiled down for you.
Exactly. Think of it as your quick guide. What we're discussing is an endocrine issue. Basically, the cat's thyroid gland goes into overdrive. It starts pumping out way too many hormones. And it's surprisingly common, especially in older cats. We see it mostly in middle-aged and senior cats, the average age, right around 13 years old when diagnosed. But hopefully after this, you'll know what to look for and what the options are.
Absolutely. We want you to feel empowered. So let's start right at the basics. What is feline hyperthyroidism, really? Your cat, well, like us, they have a thyroid gland. Tiny little thing, shaped like a bow tie, sits right under the skin on their windpipe. Think of it like your cat's internal thermostat. It's super important because it controls so much, especially metabolism.
It really is central. Part of the whole endocrine system. And those hormones it makes, they set the pace for your cat's metabolism. So when that thermostat gets jammed on high, everything speeds up. The whole system runs too fast. Now, the main cause, in almost all cases, it's usually benign tumors, little non-cancerous growths on the gland. We call them adenomas or sometimes hyperplasia, just an overgrowth of cells.
Benign. Okay. So usually not cancer.
Usually not, thankfully. A very small percentage can be malignant, more serious tumors, but that's much less common.
And I guess age plays a big role here.
Oh, definitely. Advancing age is a huge factor. The older the cat, the higher the risk. There might also be some genetic links in breeds like Tankanese, Burmese, Persians maybe. And interestingly, some older sources mention diet, like feeding only fish. But honestly, modern cat foods, they're generally balanced now. So less of a worry unless it's a very specific homemade diet maybe.
Okay, so tying it all together, extra hormones mean the cat system is just constantly revving, which, well, it explains why they might start acting a bit strange, right? Like their engine's always on. And speaking of strange, let's talk symptoms. What should people be looking out for? Because spotting this early, it sounds tricky. The first signs can be really subtle, can't they?
Extremely subtle. Easily missed or just chalked up to getting older. Or sometimes, as one vet noted, the cat seems more energetic, almost like a kitten again.
Right. Like Jenna, whose cat Whiskers got diagnosed. She said he suddenly had this kitten-like energy at 14, racing around, meowing more. She thought it was great at first, but it was actually a warning sign.
Exactly. That subtlety means diagnosis can sometimes be delayed. So paying attention is key. The absolute classic sign, the hallmark, weight loss. But here's the kicker. It's weight loss despite a huge appetite.
So they're eating constantly.
Voraciously even.
Yeah.
Eating you out of house and home, but still getting thinner. Their body's just burning through calories like crazy.
And some of the descriptions we found are so vivid, like cats acting overactive or racing around like a caffeinated squirrel. Whiskers, Jenna's cat, he got really vocal, meowing all the time, demanding food. She said he just became extra, maybe more irritable too.
Yes, irritability or even aggression towards other pets or people can happen. Their whole demeanor can change. Restless, anxious, and beyond that, there are other signs too. Increased thirst is a big one.
So drinking more water.
Yep, and urinating more. So you might notice the litter box is much wetter, more frequently. GI upset is common too. Vomiting, maybe diarrhea.
What about their fur?
Good question. Their coat condition often suffers. It can look greasy, matted, unkempt, or just sort of scruffy. They stop grooming themselves properly. And the heart takes a hit too. Rapid heart rate, maybe heart murmurs the vet can hear, sometimes even difficulty breathing because the heart's working so hard.
And can you actually feel anything?
Sometimes, yeah. An owner or vet might feel a small lump in the neck area that's the enlarged thyroid gland itself. Oh, and here's a weird one from a research paper.
Yeah.
Even though their metabolism's high, they can sometimes seem like they're seeking heat or even shivering, anxious, restless.
Wow. Okay. So the main takeaway for you listening, pay close attention. Even subtle shifts matter. Maybe weigh your cat regularly. Notice those changes in appetite, thirst, energy, coat. Don't just brush it off as old age. Catching it early really helps. All right, so let's say you notice these signs, you go to the vet. How do they actually confirm it's hyperthyroidism? What's the detective work involved?
Well, the main tool, the cornerstone really, is a blood test. It's usually quite straightforward. We measure the level of a specific thyroid hormone called total T4. If that's clearly high, it's usually a strong indicator.
And what if it's borderline? Just kind of high normal?
Good point. If the total T4 is borderline, or maybe the cat has other illnesses that might affect the T4 level, we might run a different test called a free T4. Free T4 measures the hormone that's actually active in the body, so it can sometimes give a clearer picture in those ambiguous cases. Occasionally, a thyroid scan might be used too, especially if surgery is being considered, but often the blood tests are enough. Diagnosis can sometimes happen very quickly.
Okay, so it's not just that one T4 number they look at, right? They check other things too.
Oh, absolutely. It's about the whole picture. A good vet will definitely check blood pressure. Hypertension, high blood pressure is really common with this condition.
And that can cause other problems.
It can, yeah. Damage to the eyes, kidneys, heart. So the vet might do a fundus exam, look into the back of the eye for any signs of trouble, like retinal damage. They'll also listen carefully to the heart for murmurs. Now, sometimes these murmurs are just due to the high output state, not severe heart disease itself, but they need monitoring.
Okay.
And sometimes we see elevated liver enzymes on the blood work too. But the good news there is they often return to normal once the thyroid is under control.
This really highlights something important, doesn't it? Why regular checkups, especially yearly blood work for older cats, say over 8 years old, are so crucial.
Exactly. Couldn't agree more.
It sounds like it can catch these things early, maybe before you even see obvious signs.
That's the goal of preventative care. Early detection nearly always leads to better outcomes, makes treatment easier, and helps manage those hidden issues like blood pressure or masking kidney problems. It's a total game changer.
Okay, so the diagnosis is confirmed. What happens next? Fortunately, it sounds like there are good treatment options available.
Yes, very good options. We have a solid toolkit, and it's not one size fits all. The best plan is tailored to the individual cat, their health, age, any other issues, and also what works for the owner.
And the goal is?
The main goal is always to get those symptoms under control, improve the cat's quality of life dramatically, and in quite a few cases, actually cure the condition, give them many more good years.
Let's break down those options. First up, medication. Methimazole, you mentioned.
Right, anti-thyroid medication. Methimazole is the most common one.
This seems like the go-to starting point for many, like with Jenna and Whiskers.
It often is. It works by basically blocking the thyroid gland from making too much hormone. It dials that thermostat back down. It comes as pills, which can be tricky for some cats, or liquid, but there's also a transdermal gel.
Oh, the ear gel. I've heard about that.
Yeah, it's fantastic for cats who hate pills. You just rub a small amount onto the skin inside the ear flap, usually alternating ears. The drug gets absorbed right through the skin.
That sounds much less stressful.
It can be, definitely. So the pros, it controls the symptoms effectively, it's widely available, and we can adjust the dose based on follow-up blood tests. The cons, it's lifelong, every single day, usually twice a day, and you need regular blood monitoring to check the thyroid levels and watch for side effects.
Side effects? What kind of things?
Most common are things like vomiting, maybe loss of appetite, or just being a bit lethargic, especially when starting. Usually mild and might resolve. More rarely, there can be serious issues like liver problems or effects on blood cells, which would mean stopping the drug. So monitoring is key.
And Jenna's story really highlights that daily routine, doesn't it? Learning Whiskers' moods, the occasional pill missile, finding ways with treats or the gel, it takes commitment.
It absolutely does. Now, another option is diet, a prescription low iodine diet. Hill's Yard is the main one people know.
Food as medicine, how does that work?
Iodine is essential for the thyroid to make its hormones. So the idea is, if you severely restrict the iodine in the diet, the gland can't produce as much hormone. It can work well for some cats, maybe those with milder disease, or where giving medication is just really difficult. Often comes as wet food too, which helps with hydration.
But there are catches, right?
There are. The biggest one is compliance. For it to work, it usually has to be the only thing the cat eats. No treats, no table scraps, no hunting mice.
Tricky in a multi-cat house, I bet.
Very tricky. You'd need to feed them completely separately, or use special feeders. And some experts feel the data supporting its effectiveness, well, maybe isn't as strong as for other options, especially in severe cases. So it's an option, but with limitations.
Okay, good to know. Then there's the one that sounds quite high-tech. Radioactive iodine therapy, I-131.
Ah, yes, I-131. This is often called the gold standard treatment.
Gold standard because it can actually cure it. That sounds amazing how...
It's pretty clever, actually. Radioactive iodine is given, usually just one injection under the skin. Iodine naturally concentrates in thyroid tissue. Because the abnormal thyroid tissue is working overtime and sucking up iodine, it absorbs most of this radioactive dose. The radiation then destroys only the abnormal overactive cells.
And it leaves the normal tissue alone.
Largely, yes. It spares the healthy tissue. The success rate is incredibly high, over 90%, often quoted as 95 to 98% cure rate with a single treatment.
Wow. So the benefits are huge. No daily pills.
No daily pills, no long-term medication costs or monitoring. Potentially a much longer life expectancy studies suggest it can double or triple it compared to medication alone.
But radioactive sounds intense and probably expensive.
It does sound intense, but it's very targeted and safe when handled properly.
Yeah.
There is a higher upfront cost, yes, typically a few $1,000s, but when you compare that to years of medication, vet visits, blood tests, it can actually be more cost-effective in the long run for many cats.
What about the practical side, the radioactivity?
Because the cat is radioactive for a short while, the treatment has to be done at a specialized facility licensed to handle it. And the cat needs to stay hospitalized, usually for about 3 to 7 days, until their radiation levels drop to a safe limit. That can be tough for owners, being separated.
A short separation for potentially a long-term cure, though. Any downsides besides cost and the hospital stay?
Rarely, it can make the cat hypothyroid, meaning their thyroid becomes underactive. But that's actually much easier to manage. Usually just needs a simple hormone supplement than hyperthyroidism. It's generally considered very safe and effective.
Okay. And what about surgery? Removing the thyroid?
Surgical thyroidectomy. Yeah, that used to be more common. But honestly, it's much less performed now. With the success and safety of I-131 and the ease of managing with medication or the ear gel, surgery is often seen as riskier, especially in older cats who might have other health issues. So it's not really a go-to anymore for most.
Got it. Now, this next part feels really important. We talked about symptoms, but what happens if hyperthyroidism isn't treated? What are the hidden dangers, the complications?
This is crucial, you're right. It's not just about the cat feeling unwell. Untreated, it seriously impacts major organs. The heart is a big one. All those excess thyroid hormones constantly whipping the heart, making it beat faster and harder. Over time, the heart muscle actually thickens.
Thickens, like bulking up.
Exactly, but not in a good way. It's called hypertrophic cardiomyopathy. The main pumping chamber, the left ventricle, gets thick and stiff, less efficient. This can lead straight to heart failure.
And the high blood pressure adds to that.
Absolutely. The hypertension puts even more strain on the heart and blood vessels and can cause things like strokes or eye damage too.
Yeah.
And then there's the kidneys. This connection is, well, it's really significant and often complicates things.
How so?
Okay, so hyperthyroidism actually boosts blood flow through the kidneys, makes them work harder, filter faster, which sounds maybe good, but the problem is this increased blood flow can hide underlying kidney disease. It makes the kidney function tests look better than they really are.
It masks the problem.
Wow. It masks it. So you treat the hyperthyroidism, the thyroid levels normalize, that artificial boost to the kidneys goes away.
Yeah.
And suddenly, underlying chronic kidney disease becomes apparent. It gets unmasked.
So treating the thyroid could reveal kidney issues.
It often does, which is why monitoring kidney values very closely after starting thyroid treatment is essential. Plus, the high thyroid state itself can eventually damage the kidneys over time. It's a really tricky interplay.
That's a huge reason to treat it then, to potentially slow down kidney damage too.
Definitely. And beyond heart and kidneys, untreated hyperthyroidism can damage the brain, eyes leading to sudden blindness sometimes. And ultimately, the cat just wastes away from the uncontrolled weight loss and muscle breakdown. It's fatal if left untreated.
Okay, that's sobering, but treatable. So moving beyond the vet's office, what can owners do at home to help support their cat through all this?
Great question. There's actually a lot you can do to make things easier and better for them. First off, water. Constant access to fresh, clean water is vital. They're thirsty and prone to dehydration. Multiple bowls, maybe a fountain helps encourage drinking.
Makes sense. What about activity? They're often hyperactive already.
Well, gentle play is still good. It helps maintain muscle mass, which they lose easily, and can reduce stress. Short sessions with a wand toy, maybe a laser pointer, nothing too strenuous.
And the appetite, if they're ravenous.
Managing that crazy appetite can be tough. Automatic feeders can help stick to a schedule. Puzzle feeders are great too. They slow down eating and provide some mental enrichment, which can be good for an anxious cat.
What about multi-cat homes, especially with that special diet?
Yeah, that requires strategy. Feeding the hyperthyroid cat in a separate room is often necessary, or using those microchip feeders that only open for the specific cat's chip that can be lifesavers in that situation. Consistency is also key. A predictable routine for feeding, playtime, quiet time. It helps reduce stress and, most importantly, keep observing. Watch for any changes, appetite up or down, vomiting, energy levels, litter box habits. Keep a little diary maybe, and report anything new to your vet right away. Communication is vital.
Excellent tips. Practical things people can actually do. And obviously always check with the vet before adding supplements or anything like that.
Oh, absolutely. Don't add anything without running it by them first to make sure it won't interfere with treatment or cause other issues.
So wrapping things up, what's the overall outlook? If a cat gets diagnosed, what can people expect?
Honestly, the outlook is generally very good. That's a really positive message here. Feline hyperthyroidism is very manageable and often, like with I-131, curable. With early diagnosis and the right treatment plan, most cats respond incredibly well. They can live happy, comfortable lives for many years after diagnosis, even if they have other issues like kidney disease alongside it. Managing the thyroid often helps protect those kidneys too.
That's fantastic news. So for you listening, the dedicated cat owner, what does this all mean? It really comes down to being observant, doesn't it? Being proactive, noticing those small changes, and working with your vet, as a team. You know your cat best.
Exactly. You're the first line of defense.
Your cat's subtle signals, that slightly different meow, the shift in energy, eating a bit more or less, they're like whispers, aren't they? They're a way of telling us something's up. So maybe think about this. We have this profound trust with our cats. How might getting better at tuning into those quiet signals, those little daily changes, not just help us catch things like hyperthyroidism early, but how might it actually deepen that bond we share and help us give them the longest, happiest, healthiest lives possible? Something to really think about until our next deep dive.